To Live with Hillsdale Hospital. Today is Wednesday, June 5th, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community. I'm Rachel Lott, Chief Communications Officer, and I am joined by
JJ Hodshire, President, Chief Executive Officer.
Feels kind of like the old days, JJ.
It does, just you and I.
Mm-hmm.
Just you and
no guest.
Yeah, no guest.
No
talking just for about 10, 15
give
minutes.
Us useful information.
No,
just us talking.
Just us blathering on and on and on.
Yep. We don't have any COVID stats. Remember when we used to do
we used to do all the lists.
Massive update. Yeah. And I was thinking about it the other day. We had Fake News Friday. We had What's Up Wednesday.
Yeah.
We had Live with, we had Facebook Live with Hillsdale Hospital. Yeah. And now it's Live with Hillsdale Hospital since we're also streaming on YouTube and LinkedIn.
No, it was like every day.
For a while there, I think we did 3 a week.
Inpatient numbers, outpatient numbers.
Yeah, it was crazy.
So now we've gone obviously through all of that.
Yeah.
And
I don't have to work on my spreadsheet every day before we go live.
But we do have something exciting to share today, Rachel, because I want to talk a little bit, and we won't be very long today, about primary care specifically in Hillsdale. Mm-hmm. And it's something that's often talked about by our community. And many times the concern is post-discharge from the hospital or you come into the ER. It's where do we find a primary care provider who will take us or our children with our Medicaid or our certain insurances or no insurance. And so we have to work through all that. The very first thing that I want to talk about is someone who doesn't have insurance. Okay. Hillsdale Hospital provides a financial counselor and a Medicaid specialist, both of them. 2 different positions. One is to help you manage your bill and to work on how to make those bills and how to pay your hospital stay and or any cost associated with your hospital or clinic visits.
Including financial assistance, payment plans, lots of different options.
Absolutely. And they can get you enrolled in programs. Now, the other side of it is the Medicaid specialist. And so, as you know, Medicaid is going through a redetermination period.
They are. Yep.
And it is believed that thousands of people will lose their Medicaid, in part because people are not completing the required documentation.
Right.
And in some cases, they don't qualify any longer because they have received health insurance from their employer since they've been hired after they already received Medicaid. Long story short is we have a counselor here and a Medicaid specialist who works for the Department of Health and Human Services that we subcontract with. And we have a partnership. So if you're listening today and you say, have no insurance, understand that we can try to get you qualified for Medicaid because there are plenty of opportunities for individuals. Beyond that, the financial counselor then can work with you on the marketplace, talking to you a little bit about, all right, what is available? And also the health department health services worker also can work with you on that. But really, there's options that are available for individuals who are either underinsured or uninsured for you to get services. Now, so we move beyond that.
Yes.
Some of the, the biggest challenges that we face is we have one pediatrician in our county, and that is Dr. Ellis. And she has a very busy practice with several advanced practice providers who are also very busy. Great teamwork out there, great teams. But, it's tough to get into appointments. So the question is, post-discharge, what do we do? Well, most likely, we're going to give you some information at your discharge about who you can go and see. And we give you a whole list. We can't just direct you to who we want you to go see, but we give you options and say, here's a list. What you have to do then is reach out to them and make that call. But Rachel, why don't you talk just a little bit about, if I'm new to the community or I just got a new insurance product, how do I know what's out there? Who's out there? Where's their practice? How do I find out?
Right. So for primary care, we do offer that at Hillsdale Health and Wellness right here in Hillsdale, and then also at Reading Health Clinic. So you can visit our website to see all of our locations, all of our services, and see that that primary care page under the services listing to see who all of those folks are. You can also go to the provider directory, the Find a Doctor, and there's a little drop down. You can pick what type of care you're looking for. Both primary care and family medicine are listed in that drop down. So the 2 terms are somewhat interchangeable for the most part. So we put both of those in there because just depending on what you're thinking in your head, we want to make sure you find what you're looking for. So that's an option as well. But we just announced, to the media yesterday and on our website and social media a little less than an hour ago, that we have a new provider joining us at Reading Health Clinic that we are very excited about.
Very excited.
Her name is Sherry Gillespie. She is a family nurse practitioner. She most recently was practicing in Quincy and has a stellar reputation there, is loved by her patients, and we're so excited to have her down in Reading to take care of the community there. And I will not be surprised if some of her Quincy patients also
they'll follow her,
follow her to Reading. So we are excited for that. If you want to see more information about her, that press release is up on our website right now. And we also just posted it to all of our socials. Like I said, I think it was like 11 o'clock. So not too long ago.
So Rachel, so Sherry Gillespie is coming down, nurse practitioner from this area, lives in this area.
Yes. She lives
native to this area. And we're excited to have her back. She'll replace Rachel Stump.
Yes.
Rachel has decided to do other things, and we bid her well in her endeavors and want to thank her for her, service to our county, to our hospital, and most importantly to our patients. And love her. But she's chosen to go another direction, and we are putting someone down there full time. And it's actually it's more than just one person we have going down there, because I'm excited to also announce, Rachel, today that we have a physician who's accepted a position at Hillsdale Hospital, Dr. Muse. And I'm releasing it first here, but we will have an opportunity to share a little bit about a physician who will be starting here, hopefully August. And that physician also will be down in that area seeing patients. So my commitment to our community is that we will give the primary care services that you need and deserve, without interruption. When people leave, and they always do. We've lost several people from Hillsdale Health and Wellness. We shut down Litchfield. We've got Reading departures, but we will ensure that we have continuous coverage for our patients and their families. And so what does that look like, Rachel? You want to talk to us a little bit about what that handoff looks like in terms of me as a patient? What do I have to do?
Right. So as a patient, you really don't have to do anything unless you don't have any appointments already scheduled. So if you have an appointment scheduled and you have been a patient of Rachel Stump in Reading, that will automatically just be now an appointment that you will see Sherry instead. So you don't have to do anything. There will be a provider there to take care of you at your originally scheduled appointment. Now, if you want to schedule an appointment, Sherry will be starting on June 12th is when she will start seeing patients and Reading. Rachel's last day is June 11th. So that will be, just immediately the next day, no gap there. Nope. No transition time where there's no availability or no provider. So we do still offer same day appointments at Reading. So if you need that, give us a call and we will squeeze you in where we can, when we can. It of course depends on the day and depends on how late in the day. If you call at 3 o'clock, you might not get in before 4:30. But in that case, you also have the option of the walk-in clinic here in Hillsdale at Hillsdale Health and Wellness. So that will be a seamless handoff for patients. You are not going to have to do anything proactively. You will just become a patient of Sherry's as the new full-time provider down there in Reading.
Yeah, very exciting times when we can bring folks who've been native to Hillsdale, who are known to our community.
That is we kind of talked about this last week, but that's or 2 weeks ago. This has kind of been our sweet spot lately. We have Dr. Odell, Dr. Spencer, Dr. Morgan's from the area, Dr. Carr's from the area over in Ortho. Our new Sherry is from the area. She lives in
Dr.
Jonesville.
Muse is from the area.
Yes. So this is really
exciting.
That is always the best option, right? When we have people who are returning home to practice medicine and to be part of this community long term. And, rural hospitals and rural healthcare organizations across the country are really struggling to recruit providers to their communities because people who haven't lived rural before don't really know how that works. They don't know what that's all about. There's some work being done right now in the process of medical school and residency to get more placements in rural areas so that as physicians are completing all of their education and their residency that they have spent some time practicing in rural, but to be able to really have those deep roots in our community with so many of our providers, especially so many of our new providers, is very exciting.
Yeah, especially if you went to church with them, you went to school with them, you participated in events with them. It brings community together.
Everybody loves about rural small town healthcare.
They do.
So
as you know them. So excited about the changes, Rachel. We won't belabor it too much because you have some announcements coming out here in the media. Please check us out on our Facebook and website. We feel that that's an important area for you to go if you're looking for any type of services. The other issue is that when we talk about services, it's more than just primary care. I know that was our focus today, but we are bringing some exciting things here. Dr. Logan Nathan with neurosurgery, Dr. Alam with vascular surgery. We have oncology here now,
Yes,
Rachel,
we
which
do.
is exciting.
Mhm.
Up on third floor, we have every modality that you can think of, other than doing brain surgery and heart surgery.
Right.
We're pretty much doing
doing
it.
it all.
We're
Yep.
doing it all. And so
Yep.
we're very, very excited about that.
Yes, yes. And then one other thing that we will get into on a future live is preventive care. But there is a place on our website that you can go right now, which is hillsdalehospital.com/prevent, that gives you a listing of what are some of the typical types of preventive care that are available to you that we offer here in Hillsdale. Most of them, many of them are covered by your insurance provider. Of course, it depends on the individual, depends on the condition, depends on your age, whether something is considered preventive care. But they're everything from, blood tests for cholesterol to bone density scans for osteoporosis to cancer screenings of various kinds. So you can look at that information, but we'll kind of get into it a little more.
And you got a lot. I mean, because
in the
listed
future.
on our website.
Yes,
I mean, you've got
this is on our website at
tobacco
hillsdalehospital.com/prevent.
Yeah.
Mhm.
So you look at some of those things. We're trying to improve the health
Right.
of our community.
Right.
And so there's some options
Mhm.
that the community can take advantage of.
Right.
And I'm very excited about it. Some of it covered under insurances, some of it's free that we
Right.
do,
Right.
some of it's fee for service that we do. But
Mhm.
please check it out because these are very good preventative tools
Right.
for your health.
And most people think about preventive care in January, right? When it's the new year and people are, have that new year, new you mindset. But summer is a great time to get some of this stuff knocked out that maybe during the busier times of year, if summer is less busy for you or you have a little more flexibility in the summer, that's a good time to get scheduled to do some of this stuff that you might not have the flexibility to do in other parts of the year. So
we're here for you. Obviously, opportunities for primary care. Please check our website out. Look at our Facebook. If the website will list the office location, phone number, you can call them directly. Get an appointment established. If you're looking to transition from one provider to the other, we can help you with that as well, getting your records. Please just reach out to us. We'd love to have you part of the Hillsdale Hospital family.
Mm-hmm. All right. So do we have any questions from our audience?
None today.
Didn't think so. That was pretty quick and fast updates.
Rachel, I'm going to let you take it away.
All right. We have a lot of stuff in our closing. We might need to rework this because it's really long.
It's just,
but there's some good stuff here. Okay. So instead of listing every individual link on our website, we'll just say you can find all of this information at hillsdalehospital.com.
Yeah.
So if you want to nominate a hospital staff member for our quarterly patient care award based on the experience you or your family member had, you can do that on our website. You can support our capital fundraising campaign with a donation. You can learn more about volunteering here at Hillsdale Hospital. You can also join an award-winning workplace in the healthcare industry, which is, of course, Hillsdale Hospital, and see all of our open positions. We have opportunities from entry level up through, certification and licensure. We have lots of opportunities for folks, regardless of where you are in your career path. You can also catch us on WCSR on Fridays for more discussions like this. And don't forget to check out our national podcast, Rural Health Rising, at ruralhealthrising.com, or subscribe wherever you get your podcasts. So now I'll let you do the final close.
Well, listen, we're here because of you, and we thank you for your commitment to Hillsdale Hospital. The reason we have existed since 1915, right behind us, photos of our beautiful hospital.
Can I see it behind my head?
Maybe not, but photos of our beautiful hospital is because of your trust. And we invite your trust to utilize our services. If there's ever a period of time in which we do not serve your needs to your liking, let one of us know. And we will address those concerns because we're here to serve you. And when we look at, what Hillsdale has been able to produce for our community with the level of service that we're able to provide, that when we speak at conferences across the country and we tell our colleagues across the country what type of services we have, they go, "In your rural?" Because it's hard for them to understand the full continuum of care we have here. But the only reason we have it is because of you.
Yes.
And you utilizing these services to keep your hospital strong. We then invest back into our community, tens of millions of dollars to make this community strong. So with that, we hope to see you back here again next Wednesday. Hopefully, maybe we'll have a guest, maybe not.
I gotta look.
Okay.
I gotta look at the schedule. I'm making no promises because if I do, I might not be able to meet them. So I will. If I don't know for sure, I'm not going to tell you.
That's right.
We do,
so
but we're looking at it.
We'll look at it.
But
we're Hillsdale strong when you place Hillsdale first. And so until next time, stay safe, stay healthy, and stay Hillsdale strong.